So, hi, YouTube family. Welcome once again to my channel. Today I have here Dr. Sissy. Yes, originally from Uganda, trained in Uganda, and is now practicing as a doctor in the UK. He's going to share the process of becoming a doctor if you were trained outside the UK, and then give us a few tips and all that you need to know to relocate to the UK to work as a doctor. So, if you're interested, stay tuned.
Said it before. Hey, stop that.
Hi, Dr. Sissy.
Hi, Nanel. My name is Sissy Atwine, and I'm a Ugandan medical doctor based in the UK. Yes, I'm happy to be here.
We're happy to have you here. You're the first. No, you're not the first doctor.
Trying
I
to
love
be.
being the first doctor. But you're the first doctor to share the process on my channel. So I'm really privileged. Thank you so much. How long have you been in the UK?
So I've been in the UK for nearly 5 years. I'll be making 5 years in September this year. Yeah, I came on a tier 4 visa, so I came to do a master's, and then after the 1 year of the master's, I switched to a tier 2 visa to work. Yeah.
Take us through the process. Let's say I'm a doctor in Nigeria or I'm a doctor in Ghana or anywhere else, outside the UK, and I want to come and practice in the UK. Take us through the process. What do I do? Where do I start?
Okay, so the first thing you do is go to the right medical school. So the very first thing that they want to know, so in order to work as a doctor in the UK, you need a license to practice, so a license to practice medicine. So in the steps for that is number one, before you do anything, is that your medical school has to be on a list of acceptable ones for the GMC. So probably if you're still in medical school, check and see if your medical school is on the list. It's called the World Medical Directory. If your medical school is on the list, then you're on the right track.
You
Yes.
said if I want to check if my medical school is on the list, where do I go to?
World Medical Directory.
Okay.
Maybe you can link the description in the video
Yeah.
below, or you can go and check out my channel where I've got
Yes.
all the
I
links.
forgot to say that she has a YouTube channel as well, where she says, more than this, for doctors that want to migrate to the UK. So I'll leave a link to her channel in the description, and I'll leave a screenshot on the page so you can see. And then remember to subscribe when you get there. Okay.
So you first check if your medical school is on that list, because not all medical schools are. It's very rare that you will get GMC registration even when your medical school is not on that list. But it's possible, because I do have a friend who was from Somalia and his medical school was not on the list. And he went through a long process and it was put on the list. But ideally, first be checking that you're going to the right medical school. Yeah.
So, Dr. Sissy, maybe you should do a video for people whose
Medical schools are not on the list.
On your channel, so that
Yeah.
you can educate them on that process as well.
Good idea.
Yeah. So let's say I find my medical school on the list. What do I do?
So then you're going to have to, first of all, complete your internship, or what is called a house job in several other countries. So that means you do your medical school, complete the degree, and then ideally you should complete your 1 year of internship, minimum 1 year. Some internship is longer, but GMC needs you to have at least 1 year length of internship, in which you have to have at least 3 months in medicine, 3 months in surgery, and a few other details of the way they want their internship. Next, you have to do the exams. The first one is the English proficiency exam. So it's either the IELTS or the OET, unless you're exempt. So there are certain people who are exempt. Like, for instance, if you've done a master's in the UK, you're exempt.
What is the requirements for the IELTS or the OET if I'm not exempt?
It's the same as for nurses. Although I saw your last video, you were saying they're going to change that. But so the IELTS, you should be minimum 7 in each of the domains and also overall. And the OET should be a minimum of a B in each of the domains as well.
So let's say I pass my IELTS. What next? Mm-hmm.
So you pass your IELTS. Then next you book for the PLAB 1 exam. So PLAB is the name of the medical licensing exams for the UK at the moment, although the name is going to be changing starting from 2024. So we still have maybe 2 more years or 1.5 years when it's still called PLAB. So the first one is a theory exam. So the theory exam can only be done in a few countries. So it's done in about maybe 10 countries. But in Africa, it's only done in Nigeria, South Africa, Sudan. And then outside of Africa, it's done in Dubai, India, Bangladesh, I think Pakistan, a bunch of other countries. Yeah, so if you're in Nigeria or South Africa or Sudan, then obviously it's easier if PLAB is done in your country, PLAB 1, sorry. If it's not, like for me, I'm Ugandan, a lot of Ugandans travel to Dubai just because it's easier to get a visa to Dubai than even to go to Nigeria. And also, travel within African countries is surprisingly more expensive. Like, it's more expensive to move from East Africa to West Africa than
Yeah.
to just go abroad. Yeah.
I grew up in a place where they told you what to chase, told you how to run the race. Every move was on the page, but I didn't like their way. Had to fight and misbehave, had to find a way to change, had to leave to find my way. Caught up in a daydream, I beat my mind up there almost daily. It's how I pass time, no opinions safely. It's how I understand what I want in this place, see. Cause everybody wanna tell you bad things, what could go
With the
wrong?
PLAB 1, is it difficult? You said it's theory. Is it how many questions? Is it like how is
So
it?
it's about 180 questions, and the exam is 3 hours. I don't think it's difficult, honestly, because it's theory. And it's, if you're a doctor, it's probably stuff that you already know. So I think it's easier than the IELTS. The IELTS is harder, strangely enough.
Is it
IELTS is harder.
MCQs? Is it MCQs or it's like
It's just MCQ, so you just choose
it's
ABC.
just
So
MCQs?
it's just MCQ. So that's what I love about it. The answer is in front of you. You just have to figure out what is the answer.
Oh,
Yeah.
I see. And it's 3 hours. What score do you need to move on to the next stage?
So the score will depend on who has sat the exam that year. Every sitting has a different pass mark. So if you sit in a year when people are doing really well, then it might be higher. And if that particular time the exam is maybe set much more difficult, the pass mark will be lower. Yeah. So there's no a set one every time. Yeah.
So I book that and then I pass it, and then what next? That's
So
the
then
plan.
you pass that exam. So that exam is only done 4 times in a year. So it needs proper planning, because it's only 4 times in a year. And then you apply for the club two. Club two is done every week, about 3 times in a year, but it's only in the UK, in Manchester only. So that's where now challenges come in: travel, visas, and all that. But you come to the UK, to Manchester, and then you do the PLAB 2 exam. So PLAB 2 is an OSCE, or a clinical exam, where there are, like, I think 18 stations where the actors acting as a patient, and then there'll be like an examiner, and then there's you acting as a doctor. You go in, obviously, and you see the patient as you would a real patient while you're being marked. And then same thing as well, the pass mark will be determined by, basically, I think they say on that day, how people are doing that day is going to determine the pass mark. So if you go on a bad day where everyone is really, really good, then the pass mark will be higher. And then other days it might be lower. Yeah.
So how do I get materials for the PLAB 1 to learn?
So for PLAB 1, I've made a whole video on this, on like sharing my top tips for PLAB 1. But I think my main top tip is to find other people who are doing the exam as well, because that way then you are able to like get motivation, and also like find out like what's the latest, like what the latest questions that are coming out, and also the latest like information. So for me, I found my groups on Facebook. If you just search PLAB, you're going to find PLAB groups.
There's no specific book that you have to buy to be able to help you with the PLAB exam. No.
No, so they don't. The GMC does not recommend a specific book themselves, but there are lots of books out there. Like there's by the time I was doing the exam, there was a book called 1,700 Questions. It's on Amazon, and I've linked it in my video about PLAB. So it's a specific like book by some guy who collected so many MCQs, and it was really helpful at the time I did my exam. Although I did my exam in 2018, so that's why it's good to find out someone else, like other people who are doing the exam, and see what's like the latest maybe advice. Yeah.
So I passed the PLAB 1 and then I book a visit visa to come to the UK, Manchester, to do the PLAB 2. And then I passed the PLAB 2 exam. What next?
That's it. That's the hardest bit done. The next, you will have to apply for GMC registration. So to apply for GMC registration, there's a lot of paperwork. They have to verify your medical degree, that it's like legit.
Yeah.
So, for instance, there's an organization, it's called EPIC, based in the US. They'll send a form to your medical school and ask them to confirm that did this person really study in your medical school, verify it, and then send it back. And so that can be a bit of a delay. So the sooner you know about it, the better, because you don't have to wait to do even PLAB or to pass, because once you've been verified forever, except that GMC wants their verification to be maybe 1 year old. So if you're verified very early, then you might have to pay a fee to get like a fresh certificate or something from those EPIC guys. GMC also requires you to have a certificate of good standing from your own country's medical council. So that's why at whatever level you are, guys, be doing a good job, do what you're supposed to do. Don't be getting into unnecessary trouble because maybe you have plans of leaving, you don't care. Please don't be like that, because eventually they need to know that you haven't committed any crimes in your own country and your own medical regulatory body is happy with you. Yeah. They also need the history of like your work history. Like, where have you been working? What have you been doing? Those kind of things. Yeah.
So, what would you say are the main challenges in the process?
Money. I think the main challenge is really money, to be honest. Because when you look at these steps, the exams aren't that difficult, because I feel like personally, African medical education is so tough. Like, they're so hard on us, they're so strict, and also it's so old school. Like, you're going to have the knowledge, you're going to have the skills, because we have such hands-on skills from such an early like level of training. People are assisting in C-sections from like even like fourth year. Like, you have the skills, you have the knowledge. So the problem is really getting the money for these exams, because they're quite expensive. So PLAB 1 is about £250, I believe, and then PLAB 2 is about £850. In the UK, money doesn't sound too much, but when I'm thinking back at my own salary as a doctor in Uganda, it was like £200. So it's like your entire salary in one exam. Yeah, I think that's the biggest deal. But I think it's really worth it if you're committed, and also if you're looking at a bigger picture, because when you do come to work to the UK, then you can make all that money back in a pretty short period of time.
We'll get to that. We'll get to that. with nurses, when we do the IELTS exam and then the first exam, that's a CBT, usually some countries, like the applicants, get agencies to assist them through the remaining process. So, for instance, for me, my OSCE was sponsored by my employer. They actually sponsored me to come to the UK to practice as a senior carer for a while until they trained me for the OSCE. For doctors, is it like that? After
Not
PLAB,
at all.
get
Not at all. It's so much easier to come as a nurse than a doctor. Because I have a friend who's a nurse as well, and she was telling me, and it's like, what? You can't even come before you finish the exams? We have none of that. The only thing is there are agencies, there are recruitment agencies that can help you. So these agencies sometimes can pay for your exams, but it's like a loan. So they'll give you a loan to pay for your PLAB 1 and your PLAB 2, and then you have to work for them, and you're bound to them for a period, like maybe a year. And then they make like a payment plan where they deduct their money back slowly.
You mentioned a few agencies that are assisting people.
So I only know one agency, and unfortunately I did contact them myself to find out, but they've stopped doing that. So the agency is called NES, NES. So that agency used to pay for people's exams, but the thing is, recently the WHO released some guidance saying about ethical recruitment of health workers, and in particular for doctors. I don't know about nurses, but they were saying that ideally rich countries should not be actively recruiting.
It's the same with nurses as well. There are some countries on the list where active recruitment has been banned. So agencies are supposed to facilitate for people from those countries to the UK.
Yes.
Yeah.
So the agency told me that since they brought that into effect, they can no longer like help you to that extent. It just makes it harder for you as an individual. It just means that you have to apply for the job directly, but the jobs are still there. There's still a huge shortage. It's just that the agency option has kind of reduced, but I know there's still some agencies hiring, but not necessarily going to go to the level of helping you in terms of like paying for exams. And
so what's a normal shift like? Are you in the NHS? Are you in the GP surgery? Where are you?
So I'm in the NHS and I'm a psychiatry trainee. So I'm training in psychiatry. So it's like a residency program, like in the US, for instance. So that's where it's a training job. So I'm being paid, I'm seeing patients, but at the end of it, I'm going to like be a consultant, which unlike, let's say in Uganda, when you're doing these programs like this, you are the one who is paying. You, the doctor, pays, and yet you're working for free. Yeah, so anyway, so I'm a psychiatry trainee. So the shift really is going to depend on your specialty. Before I was in psychiatry, I was in acute medicine. And in acute medicine, I was on the wards. So ward work in physical health hospitals is different from mental health hospitals. So in physical health hospitals, it was like you go in the morning, you have like a team meeting, an MDT meeting with the nurses, the occupational therapists, the physios, discuss all the patients, make a plan, and then do a ward round with a consultant. And then after that, you do the jobs that come up during the ward round. That's how a regular shift is in physical health hospitals. And in psychiatry, it's different because I am now in an inpatient mental health hospital, and we also start with an MDT meeting with the nurses and the carers and everyone who's involved on the team, discuss all the patients in the ward, and then after that we do ward rounds as well. But our ward rounds are different in that because our patients are usually physically healthy, they just walk into the room, they see you, they go out, and then any jobs that come up as well, I have to do them as the junior doctor on the ward that are related to like physical health stuff.
Okay. So how many hours usually per shift?
So my hours are usually, so it's 9 to 5 is a normal day.
For the psychiatry trainee program. But when you were a shift,
everyone, a normal day is 9 to 5, but we also have long days. So sometimes I have 9 a.m. to 9 p.m. shifts. Other days I have night shifts, which would be 9 p.m. to 9 a.m. the next day. So because when you're on the rota, when you're the on-call rota, then you will have a mix of shifts. If you're not on the on-call rota, you can just have 9 to 5 and not be on call. So that means less money usually. And if you're not a trainee, if you're a trainee, it's compulsory to be on the on-call rota. So you don't really have a choice. Yeah.
Now let's talk about the money. How much do doctors get paid in the UK?
So I've made a whole video of detailed how much is paid per level. So it will depend on what level you are and what specialty you are and how many hours and so many things. But on average, it should be about £2,800 after taxes, £3,500. But that is SHO level. You're not a consultant. So an SHO is a senior house officer. So you're not a consultant, or a registrar. So registrars earn higher than that. They earn like above 3,500 at least and above. So these are more senior trainees. And then consultants, I believe, I don't know how much they take home, but I know like per annum is about £76,000 on average.
So for someone who has just gotten a job after passing PLAB 2.
So after passing PLAB 2, you're an SHO. So at that level, then you are going to get about 2,000, maybe 2,400 to 3,000. Yeah, realistically around that range.
And then when you do overtime, let's say, do you have opportunities to do overtime? Let's say work in the private hospitals and stuff.
So I've only done overtime in my own trust, but you can sign up with agencies and like do locum shifts. But the good thing, there's so much opportunity because it's so funny how sometimes people have a hard time looking for jobs when they're coming, but when you come in, there's so many jobs. Constantly, your email is just going off. And for overtime shifts, so for me personally, in my trust, they pay us £40 per hour minimum, or 55 or 75. So depending on how urgent the shift is. Like if they put up the shift and we need someone for tomorrow, they're going to pay like £75 per hour. But if it's next week, they might say 55. And if it's like a month in advance, £40 per hour. So that means in one 12-hour shift, you can make from £400 after taxes to even £800 in one shift. So that means if you plan it properly, you could be doing like maybe 2 shifts a month extra, and then that way you can get some good money. Yeah.
Wow, I envy you. Wow. How different is being a doctor in the UK compared to back home, like let's say Uganda?
So I think the main difference is in what is called shared care or shared decision making with patients. So back home we have a lot of paternalistic medicine, which is where you, the doctor, you're the expert, you know everything. You come in and you boss the patient around. You're going to do this, you're going to do this, you're going to do this. But here there's a lot of like involving the patient in the decision making, because we recognize that you're the expert, the doctor is the expert in the disease, but the patient is the expert in their own life and what they can handle and what side effects, like what side effect would they rather have? What medication would they rather have, take an injection or a tablet? So that's what I love about it, is that the patients are involved a lot, which I think is a good idea.
So if, let's say, I'm coming to the UK from overseas, between the NHS and let's say private and let's say doing straight locum, which one pays more?
So I think that it would be really hard to come to do just locum. It's a bit difficult coming to just locum, but private definitely pays more than the NHS, and locum I think pays more than all of those, because the rates are higher. Locum rates are always higher than any of them. But then also that means like there's less benefits in terms of like pension contributions. Maybe there's no pension contributions, I'm not sure. But I know there's some disadvantage in that aspect of the locum.
And with the locum, you might not get like a company, an agency to give you a certificate of sponsorship to apply for it.
Yes. Private usually is through agencies, actually. The people who I know who've come through agencies place them in private hospitals. Yeah.
So if I'm looking for a job, let's say I passed my PLAB 1, PLAB 2, where do I go to search for jobs?
You go to the NHS Jobs website. I think it's called NHS Jobs. And then there's also the track website, I believe. Yeah, but I personally got my job from the NHS Jobs website.
Okay.
Yeah.
And how long did it take you, the entire process?
So for me, because I was already here, because I was doing a master's, I did PLAB 1 in March and I did PLAB 2 in July. And then I had my job by September of the same year. So it didn't take long at all.
How friendly are your colleagues at work?
They're very friendly. I think British people are very friendly. They're very polite. Yeah, I don't feel like people are not friendly. They're very friendly. It's just that the culture. That's the culture. It's like you're gonna be talking a lot about the weather. We're gonna be talking a lot about, I guess, the TV shows. Yeah, but people are very friendly. Yeah.
So you haven't faced any sort of like discrimination or anything at work?
Maybe microaggressions. I attended an equality and diversity seminar today, and the main thing, like British racism in general, is mostly subtle, but then that makes it even more difficult because you're not sure what was that. Like actually, one of the sessions was called "Was that racist?" So once you're having that question, was that racist? It probably was. So
I've had something like that. I've had an experience like that before. Yeah.
yes.
So yeah.
Yes. So that is the racism that I've experienced, has been mostly subtle microaggressions. Like it's not outright. It's not like, yeah, making it even way, way more difficult to deal with. Because they were telling us today, oh, you should report this because racism is illegal. But then, like, what are you going to report, If it was just the feeling that they gave you, or the way they asked you, or the tone. Yeah, but generally, personally, I've had mostly positive experiences, and I'm still on the journey of learning how to deal with all these issues. Yeah.
Yeah. So your final words for people that want to move.
So my final words for people who want to move is that you can do it. So look at the big picture. Look for people who have been there. I am volunteering myself. I do have a whole channel where I share the whole process. And yeah, just look at the end goal. You'll make it, and good luck on your journey.
Thank you so much. I have personally learned a lot. Guys, if you have any further questions, head over to Dr. Sisi's channel and then ask her all your questions. Subscribe to her channel, ask her all your questions. Okay. Thank you so much. I've benefited from this. Thank you so much.
Thank you.
Bye.
Bye.